All right, good afternoon, everyone. Today I am super excited to introduce you to someone from Love.Life who you may not recognize. But first, a little bit about me. My name is Dr. Niki Davis, and I am a former rocket scientist turned lifestyle medicine physician with Love.Life Telehealth. And I am very passionate about helping my patients get well and stay well by treating the root cause of their chronic lifestyle related medical conditions so that they can live life to the fullest. Now, today is extra special. I have the absolute pleasure of introducing you to Dr. Anna Emanuel. Dr. Emanuel is the lead integrative medicine physician at the in-person Love.Life Health facility in El Segundo, California. Now, I am so excited to get to know her a little bit better and for you to get to know her as well. So hi, Dr. Emanuel. I am thrilled to get to chat with you today. How are you?
Good. Thank you so much for having me. I'm excited to finally get to do this with you.
Me too. Yeah. Well, so I always like to start out, we've been doing some of these doctor interviews with not only the doctors that work with me on the virtual side of the telehealth side of Love.Life, but also, I had a chance to interview one of your uh, other physicians over in El Segundo at the Love.Life facility. That's the in-person facility. But whenever I talk to any of the doctors who we all work with, I always like to just start out by finding out what was it that made you decide to go into medicine?
Yeah, I am actually one of those kids who, always wanted to be a physician. And I think it was just that incredible intersection of science and humanities. So that was really my journey through high school. And I actually had a crossroad when I ended up applying to colleges because I was also a competitive swimmer. And I
Oh,
had so I had a academic scholarship and an athletic scholarship that I had to decide on. And at that time, choosing medicine was sort of the end, the end goal and my North Star at that point. So I ended up going down that route of academia. And that part of me that wanted to be a doctor evolved through time because when I went to university, I spent a year of that time abroad in Africa, and I helped with a public health initiative, also working alongside two American physicians who were emergency medicine and OB-GYN. So just a really unique experience where I saw how much medicine can help in so many different ways. And what's unique about my experience there also is that I started to have an intersection too with the sort of different types of philosophies of medicine, because in Africa, there were also spiritual healers in addition to our Western medicine, and kind of seeing how people would accept our type of medicine going into their culture, and lots of things to grapple with when I was just 18 years old. But that sort of set up the foundation of what I think I would eventually do as a physician.
interesting. Okay. So
Yeah.
then, what made you decide? Because you ended up going through family medicine residency, right?
Yes,
So
I
what?
did.
So yeah.
Yeah.
So
So
what made you decide to do that?
yeah, great question. I ended up at Loma Linda for medical school. And as you know, Loma Linda is one of the five blue zones. And that was another, I would say, introduction to a different way of practicing medicine, because one of the core tenets of that program is whole person care. And so from the first year of medical school, we had a unique curriculum that would look at the mind, body, spirit of a person beyond just the physiology. However, Loma Linda is, also a truly incredible medical center, and that is why I stayed there for residency, to get the best comprehensive training. Loma Linda is a level 1 trauma center. We saw pretty much all of San Bernardino County, whether it came to ICU, family medicine, pediatrics, OB-GYN. So the training there was incredible. And that's really what I wanted as a foundation of being a very good doctor that would be able to pick up nuances of disease. So that was family medicine. As I was mentioning before, with the kind of whole person care approach, Loma Linda was also, I think you'll appreciate this, was a pilot site for lifestyle medicine curriculum. And so family medicine doctors could get a lifestyle medicine certification while training there. And that was my first introduction to food as medicine and the power that we have over our health through the choices that we make through nutrition and exercise.
Yeah, great. And I'm so jealous. I think training in Loma Linda must have been fantastic, and having that access to lifestyle medicine during training, because that
Yeah.
is something that I really was hoping that I could get. I was a little bit, I don't know when you graduated, but at the time when I was kind of going through residency and all of that, there weren't really programs out there yet. It was just kind of starting to get traction. So that would have been fantastic had I been able to integrate that lifestyle medicine component into my family medicine training. So did you come out then with a certification in lifestyle medicine or being board certified in lifestyle medicine after you completed your residency then?
Yes. So I went through the curriculum while I was there.
Yeah.
Yeah,
Okay.
that's right.
Awesome.
Yeah.
So then, so tell me then what ended up happening. What did you do out, once you graduated and you had your board certification in family and lifestyle medicine? Tell us a little bit about, what you decided to do with your career.
Yeah. So as I mentioned, family medicine did give me that super strong foundation of comprehensive care. However, during my training, I did become frustrated that patients were not really getting better. It was that band-aid approach of giving more medications. And, as much as we had the best of Western medicine, it wasn't really moving the needle. It was just addressing symptoms instead of the root cause of disease. And I always felt like there was something kind of missing. And in addition to that, I would say most functional doctors, we all go through our own health journey before we discover that there are other tools that can bring true healing by addressing that root cause. And so while I was still in residency, kind of in parallel to residency and the lifestyle medicine track, I was starting to attend conferences and became involved in the integrative and functional medicine world because that frustration was sort of, lending me to want to search for those tools and find healing where it is possible. With disease, as you know, Niki, it's so much easier when we get to when we prevent, right? When the disease is there, it's so much harder to reverse it. And that's where I really wanted to meet my patients, that before it became type 2 diabetes, right? That it was decades before that diagnosis was made, that choices could have been different, that I could have helped empower my patients to think about health in a different way. So that was, again, I would say I've always been a very curious person and never accepted the status quo as I was presented that's the only way to be or to practice. And I knew that there was another way. So I was very fortunate to discover like-minded practitioners at such an early stage in my career. And so that I could combine all these disciplines to offer the very best care to my patients and, move forward with that tenet that our bodies do want to heal themselves. And we are just, providing the tools for that to happen.
Yeah. So then, what did you end up doing then for training to for integrative and functional medicine? So it sounds like you practice both of those in your current practice, working with Love.Life.
That's right.
So what did you do for that training?
Yeah, after residency, I went to the University of Wisconsin-Madison. It is a another exceptional training center for my academic integrative medicine fellowship. Very evidence-based approach to this whole person, root cause minded practice. And while I was there, I also completed my medical acupuncture certification. I completed my yoga teaching certification, and I also completed additional functional medicine training.
Wow, so very well rounded.
I wanted to learn as much as I could to, again, provide the best of all worlds, and mix, provide all these different philosophies of healing to my patients.
Yeah, so interesting. And I get this often myself as a lifestyle medicine physician where, people will say, well, what is that? What is lifestyle medicine? And so I try to explain to them the 6 pillars that include, eating a healthy plant-based diet, getting good exercise, good quality sleep, staying away from harmful substances, etc. But often I'll have people say, so is it similar to functional medicine or integrative medicine? How are they different? So with you being trained in basically all of these, how would you describe the difference between, say, family medicine, lifestyle medicine, integrative medicine, functional medicine? Where do you draw the differences? Because you really truly do have all of the education to be able to answer that in, I think, the best way possible.
Yeah, I think that they all have unique perspectives on health and healing. Lifestyle brings in the best of, focusing on plant-based, plant-forward medicine, and really that pillar and foundation of exercise. Integrative medicine brings in philosophies of mindfulness, traditional Chinese medicine, Ayurvedic medicine, and how they can all also support healing. And functional medicine looks at root cause medicine. So I always say functional medicine is when we all did biology and we all learned the Krebs cycle. And then in medical school, we were told that none of that matters. But it does, because that is, the way our body makes energy. And by supporting our mitochondria, by supporting our cellular health, we are able to optimize our health. So they all play a very beautiful role in providing that healing journey, kind of depending on the person and pulling on the different levers. But overall, I would say that I just want people to know that lifestyle integrative functional medicine is not just, alternative medicine, which is what it used to be called. It's better medicine, because yes, we've all been trained to treat acute conditions very well, but it's really managing the chronic disease that Western medicine does not do well.
Right. And I'm glad that you bring that up, because we are very good at fixing acute problems, right, in conventional medicine. But what most people are struggling with now in most of the world, especially in the States, is chronic lifestyle related diseases, right? And we aren't really getting to the root cause in typical, when you go to see your family doctor or your internal medicine doctor, it is a lot about, okay, well, your blood pressure is still high, so now we're going to start another medication for that. And we don't really focus a lot on the root cause and helping people through that process. So I appreciate that you have all of that training and you're helping people to really truly get down to the root cause and help people get well. Do you often get to see people getting off medications who you see?
Oh yeah, absolutely. All the time. And as we were saying before, a lot of times these medications are used as Band-Aids right, for symptoms. And then these medications then cause other symptoms that we need to band-aid with other medications. So it's not a sustainable approach for those who want to optimize health. And that's where a place like Love.Life comes in, because with Love.Life, we are able to actually provide that ecosystem that addresses the mind, the body, and doing all of that in community. So that's the way that medicine should be practiced. And I would say the type of people that are coming to Love.Life are those that, realize that their health could be optimized, that they want a different type of medical team, that they don't want to end up on medications like they've seen their parents, their grandparents end up on. And finding also someone, a physician that is able to look at the cues of the spectrum of disease and guide them in the right way, because people now are interested in health. They're not interested in medicine. They want to get ahead of things. This is medicine 2.3, that medicine 2.0 was that Band-Aid approach, and now we've entered this era of medicine 3.0.
Yeah, and I do see that as well, that I have patients who come to me who are the same thing. They're very interested in their health. They don't want to follow in the footsteps of their grandparents or their parents. And they really want to find a better way instead of just adding more and more medications to the pill box. There's got to be something else that can be done. And it's a big relief, I think, for a lot of patients, a lot of people who find this type of care and feel like, okay, finally I have someone who's listening to me and really cares about my goal, which is to be healthy and to not rely on a lot of medications, like a Band-Aid, like you mentioned.
Yeah, absolutely. And in the end, everyone is unique to some degree, and we're to a lot of degrees. And so honoring that in the healing journey is also very important, and kind of going back to what are the tenets of integrative lifestyle and functional medicine is treating each individual as that N of one.
Yeah. Well, so I'm interested to hear if you have a specific patient story that you can tell us about that, something where maybe you had an especially good outcome or a good experience with that patient, if you wouldn't mind just telling us a little bit about that.
Yeah, I'd love to. And there's so many, but I would say that one that kind of stands out in my mind right now is a perimenopausal patient that I had, and that I had the privilege of working with for over a year. And she came in with very typical symptoms of weight gain, pain, bloating. And up to that point, she was just given, very surface level type of answers of, this is perimenopause, and these types of symptoms show up with aging. Aging is not a disease. Aging puts us at risk for disease, but aging is not a disease. And that is something I really try to reframe with my patients. So that was step one, right? Of helping her believe that she can have a restoration of her health if we just address these root causes very systematically. So the first thing we worked on was her gut, because the gut is extremely important for detoxification, for hormone support, for micronutrient balance. And we found that she had SIBO. And so that was the first thing to treat. Second of all, she had a very stressful job. So we navigated how she can maybe, pull back from that and spend extra time taking care of herself. She started moving more. She realized that sitting was something that would be aggravating her back pain. And so she started, incorporating more movement throughout the day. So that the sedentary nature of her job at that time wouldn't be kind of causing her to not be able to train and work out with her personal trainer. So she was finally able to get back with her trainer. The stress was better. Her SIBO symptoms, I finally treated, and she needed a little bit of hormonal support. So I started that for her, and she started losing weight for the first time. First it was 10 pounds, then it was 20. After 6 months, she had lost 40 pounds. And this was the first time she was able to do this, and it was staying off. This is without any sort of weight loss medication. She was able to do that without additional support. And, she felt like she had her life back. And not only that, at 51, she felt the best she had ever felt in her life. And with weight loss, I would say it is a little discouraging at times, because we kind of use that 1 to 2 pounds a week ballpark of being a pretty, safe and sustainable way of losing weight. After a month, that's 4 to 8 pounds, right? That doesn't seem like a lot, but she stuck to the course. She trusted the process. And 6 months later, her life had transformed. And that is a great example of how functional integrative medicine is practiced, because we, as physicians are the support system. We provide the tools, but as a patient, the patient is in the driver's seat. And sometimes, we've been sort of indoctrinated to think that there's a quick fix and there's an easy answer, but that's not the case for health. And sometimes there's bumps in the road. Sometimes we take one step back before taking 2 steps forward. And as a integrative and functional doctor, my role in that is to be that support system through these bumps in the road, and support as we get to that end goal that is unique to each patient. So that is why I do what I do, is these types of stories.
Yeah, and wow, just amazing. And I have to agree with you on a lot of the things that you said. I find the same, especially with weight loss, that slow over time is what's the most sustainable over time. When you're looking for a quick fix and you're trying, you want that quick weight loss, or you want that quick improvement in your blood sugar, your blood pressure. There are going to be those stories where people have these dramatic results, but I would say for most people, it really is that slow consistency over time. It isn't this quick overnight thing, because like you mentioned, there are going to be bumps in the road. I mean, absolutely they are. It's just what happens. This is a journey to be on. It isn't about that you're going to be perfect from day one and have these amazing results. You have to learn how to be consistent over time. And once you do that, that's when you really start to see those results, even if it's a half a pound of weight loss a week, right? I mean, that still adds up over time. And especially in people who've gotten to plateaus or they've struggled with weight loss, having that over time, it does add up. So I really like that. I think that that's really important for people to understand, is, the consistency is really important. It's not about that being perfect all the time.
Yeah. And, I'm a reader. I love to read, and there's obviously a huge place for mindset and for habits. So, I think there's been a lot of books on setting habits in the last few years, and we really find that even making a 1% shift and being consistent in that can make such a huge difference. So, like you're saying, it's not trying to make these, grand life-changing decisions and moves within a short span of time, because we know through behavioral science that just doesn't work. And so being very intentional and pragmatic with what can I change and can I be consistent with that, that's going to make long-term the biggest difference in our health.
Right. Making those very specific small changes and then adding to that over time. Because, I grew up in an era where it was very much, okay, here's the new diet that everyone has to try. And you decide to start that on a Monday, right? And you completely change everything that you were doing on Sunday. And on Monday, it's brand new, all different. And you have in your mind, I have to be perfect. I'm going to be strict. I'm sticking to this. Where in reality, making those little tweaks over time and being able to make that become part of your normal, part of your second nature, is so much easier to integrate into your life. And then it just makes it easier to add one more thing. I'm sure you've seen this with maybe yourself or with patients, but as you make good decisions, say you decide, okay, I'm going to go and take a 10-minute walk twice a week. Suddenly on that day that you're walking, you're out for 10 minutes, you're in the sunshine, you're feeling good, you come back, you're feeling happy. Now you say, boy, instead of that, takeout from the fast food place for breakfast, I kind of want to eat something a little bit healthier. You start to make healthier choices just by default by starting making those small, healthy choices. It just builds up over time.
Exactly. Yeah.
Yeah. So, okay. So let's see. What are your hobbies outside of practicing medicine? Tell us a little bit about you. What do you enjoy doing?
Yeah, I'd love to. So like I mentioned, I was a competitive swimmer. So movement, I would say, is still a huge part of my life. I really enjoy strength training. My patients can, see me working out at our amazing Love.Life gym after work. That is sort of a non-negotiable for me. I also love hiking, camping, traveling. California is so beautiful, and there's so many incredible places just a short driving distance away. And I also love music. I sing. I used to sing a lot more. I was in an a cappella group in medical school. We were called the Ketones.
That's pretty cute. I like it.
Yeah. And I've sang at weddings. And I don't get to do it as much anymore, but I do enjoy that when I get the chance. And I've dabbled as well in writing music as well. I also enjoy spending time with my husband and my dog and cooking. I'm gluten-free, so it's thankfully much easier to cook now with that gluten-free restriction, but always looking for new exciting recipes to incorporate into my week. And like I mentioned, I also enjoy reading. So that's how I spend my time outside of work.
That's great. And are you originally from California?
I'm not, no. So I grew up in Canada, and then I did high school in Arizona. I usually tell people I've been all over, but now I usually say just, pretty much explain where I've gone and where I've been. So Arizona for high school, I did college in Tennessee. Like I mentioned before, I spent a year in Africa. I also lived in Poland before medical school, and then really have been in California since, other than the year in Wisconsin for integrative medicine.
Wow. Yeah, you really have been all over.
Yeah.
So what brought you to Poland?
4 countries. Yeah, 4 countries and 5 states. Yeah. Yeah.
Yeah, amazing. So what brought you to Poland?
So I'm Polish. My family's from Poland, and I wanted to spend time just with my family. I was teaching English there and traveling and sort of, spending time with grandparents, aunts, uncles that otherwise I wouldn't have been able to when life gets busy after medical school.
Yeah, fantastic. All right. What do you say to someone who is on the fence, wondering if they should engage with a Love.Life doctor, whether in person at El Segundo or even just remotely via telehealth?
Yeah, Love.Life is truly like nothing else. It is an ecosystem, right? Where we have a gym, we have functional integrative medicine doctors, we have a delicious cafe, we have cutting edge recovery services, a spa, incredible workout and fitness classes, and that is the future of medicine and the future of healthcare. So usually most people, when they come into Love.Life, they are just so overwhelmed by what they've been looking for, that they've been wanting this kind of team, and they're looking for this different way of optimizing their health. We do advanced diagnostics, labs, and then we integrate the integrative types of philosophies of acupuncture. We have Reiki, personal training, physical therapy, and also nutrition with our registered dietitian. So really everything under that one roof type of approach. And the difference is that we focus on optimization, not just disease management. Although we do that and we do it very well, it's that additional lens. It's wearing different hats, having different tools that makes us stand out from other physicians and other clinics.
Yeah, and so if people are looking for a primary doctor, is that something that you can offer at the in-person Love.Life facility?
Yes. Yeah, great question. We can absolutely act as a primary care physician, and oftentimes our members do elect that we carry that piece on for them. And so we are able to make referrals, order imaging, and address any acute, subacute type of symptoms that if they don't need truly emergent care for, we're able to address that in clinic without the wait times. We have a beautiful waiting room. So it's a much more enjoyable experience. And it is really reframing at the status quo of what people think of a medical clinic and a doctor's office. And it's changing the relationship with their physician, that they don't have to see me just when they're sick, but if they have questions, if they want to make certain changes in their health, that the discussion is outside of the walls of just disease management, that we can be so much more for them.
Yeah, and helping with optimization of the health, and not just fixing the problem when it comes up.
Yeah, exactly.
Yeah, great. All right, and then I did want to ask, what do you wish people knew about integrative medicine or functional medicine, in how it differs from, I would say, more traditional or conventional medicine, what people are more used to? I know we talked a little bit about, getting to the root cause. Is that where you feel that difference really lies?
I do, yes. I would say that is a big piece of it. First of all, if someone is looking for an integrative or functional provider, I would, strongly encourage to find working with someone who has completed medical training. And the reason for that is we, as physicians, we've gone through rigorous training to identify disease, to treat it when it comes up, right? We cannot understate the value of that, of being a board certified physician. And so that is an important lens to still be practicing through. However, integrative and functional medicine is really having those additional tools and being able to spend additional time with the patient too. I don't think we've talked about that, how we are able to spend, an hour. And in that time, I think that healing is proportionate to the time that we're able to spend with somebody. So we have that time, we have that luxury to understand where someone is coming from, where they've been, where they are today, and where they want to be. Understanding that the course of someone's life and what brought them to where they are today, and that will help us better get them to where they want to be. So the time piece is also very, very unique to the way that we practice.
And I'm so glad you brought that up, because I feel that having that extra time is not only beneficial for the patient, which you've mentioned, getting to sit down with your provider for 60 minutes and really feel like you are being heard, you're being listened to, you're not just being rushed in and out, that you really can talk through those important things. And it isn't just, writing a prescription and out the door within 10 minutes. But it's also beneficial for the provider themselves, right? Because of going through residency training, you would have been in a family medicine clinic seeing patients every 15 or 20 minutes and feeling that pressure of seeing enough patients throughout the day, making sure you're getting in and out and doing everything that you need to do. But even though I only did that type of clinic medicine during residency, it's easy to see how you can get very burned out as a provider, feeling like you just never have enough time. Because for me, when I was going through residency, I was already interested in lifestyle medicine, and I was excited to do the medicine that you and I are doing similarly today. But knowing that I had to go through that process, right, of training in a conventional setting. And so that was really hard to feel like I could share the knowledge that I already had about lifestyle medicine with my patients, because I already had so many things to do in that very short window of time I had with them. Sometimes it was just giving them a handout on the way out the door. That's all I could really do. So it's so nice now having that extra time. And I think that actually ends up improving the patient experience, because you have a provider who is happy and excited about what they get to do. Do you feel that way? Do you feel like, how do you feel about the kind of work that you get to do today?
Yeah, I totally agree with the timepiece, that it's sort of the antidote to what the distraught medical system that we have. It's an antidote both for the provider and for the patient, because it is a much more enjoyable experience, and an experience that provides results when you have that time to spend with somebody. I feel extremely privileged that I'm able to practice in this way, and that I actually see patients get better. As I mentioned, a lot of us have gone through our own health journeys, and I've seen how my life has evolved for the better by setting the foundation, and by practicing what I preach, essentially, because I did get long COVID 5 years ago. I had COVID sort of back before we even knew what it was, really, sort of early 2020. And a lot of people, they don't get the tools, they don't get the answers for chronic fatigue syndrome, long COVID. And I'm lucky that I was able to find answers, and that I am here today. In addition to, so the personal journey is just remarkable for me to see how it's helped me. And I see the same for my patients all the time as well.
Yeah. Oh, that's amazing. All right. Well, one of the last things that I wanted to ask you today is just tell me about your overall healthcare philosophy.
Yeah, I would say my philosophy for practicing medicine is really just personalized and proactive versus that reactive approach. I focus on metabolic health, gut health, hormones. Also, I have a particular interest in preventing cardiovascular disease. So I spend a lot of time with patients on optimizing that. And as a competitive swimmer, I have, always been researching and trying to bring in the best of fitness and recovery and nutrition so that we can all perform at our, so we can all perform at our best, because performance isn't just, high level athletics, although, that is a goal for some people. Performance can also be cognitive health and being a better entrepreneur, being a better business owner, being a better, better at our jobs, being better for our families. So performance can mean a lot of different things. And I think that fitness and movement is so important for that. So I spend a lot of time on really getting into the details of that with my patients. I also have the privilege now of working with some high-level athletes as well. And that, that's sort of the culmination of my passions, which is medicine. And like I was saying, humanities at the beginning, but also being a competitive swimmer and being able to practice all of that in one place under one roof in a truly incredible facility. A big part of care plans for me too is bringing in the recovery services, because as we get older, we are more prone to injury. So a big thing I see is we want to move again. We go to the gym. We maybe don't do it in the right way, and an injury occurs, which sets us back. So injury prevention, recovery is so important. I am so passionate about this topic that I'm actually leading a 4-week series at Love.Life in Los Angeles. This will be in April. And the title of the series is Fitness for Longevity. So I'll be getting into really the most up-to-date data and research and science on exercise physiology, the types of workouts that we should be doing, what recovery will help that piece, recovery modalities, also nutrition for longevity, nutrition for performance. So I'll be touching on all of the latest and the greatest when it comes to fitness.
And how can people access that? Is that something that's going to be in person only, or will it be something that people can watch online?
Yeah, for those who are in Los Angeles, we do have limited seating. So I would recommend for those who would like to attend to sign up as soon as possible for the 4-week series, starting on, I believe, April 9th. And then after we complete the series, it will be uploaded to YouTube. So for those who are not local, they will be able to watch the series online.
Oh, fantastic. And, it's interesting because I know that at Love.Life you have pickleball courts, correct?
Yes, that's right.
And that is something that I play, and I have seen a lot of injuries. And I think that it's just that it is something that it's fun. And if you haven't maybe been very active, it's an easy way to kind of get started on something that's active and social, and it's easy to learn. But I do think that there is a component of making sure that you're ready to play something like that, and having that knowledge ahead of time of how to prepare yourself so that you do decrease the risk of injury from that. Because I have seen a lot of injuries. I don't know if you've seen the same.
We have, yes. We are, again, lucky to have an incredible physical therapist on site. We have personal trainers as well. And so for our members, that, to your point, that intentional approach we take so that we can prevent injuries. We can strengthen those joints that are weak. With pickleball, often we see ankles and knees, and that is an important part of our approach for our members. And so not seeing as much injuries there, thankfully, but
Good.
I would say more of the drop-ins. If anything, but we, I think there's even been a few articles published about the uptick of injuries with pickleball. So
I'm not
definitely
surprised.
yeah. Mm-hmm.
Okay. And then, this is a nice message from someone who you must see. You are providing the best primary care experience I've ever had. The amount of time and systemic view you take is life-changing for me. Thank you, Dr. Emanuel.
Oh, thank you so much.
Yeah, so that's so nice to see. I think it's just great to see that people are having such a good experience with both the in-person side of Love.Life and the telehealth side of Love.Life.
Yes.
I know I say this all the time, but I just feel really grateful and lucky to do what I get to do every day. And as a physician, you probably feel this way as well, but how lucky are we to get to see people get well instead of just sicker over time, right?
Yeah. I mean, at the end of the day, Niki, I think that's like the best way that we could wrap this amazing conversation up, because that's really what it comes down to. We all went into medicine to help, to heal, and we have the tools. We see this with our patients that they are getting better. I see my colleagues on the conventional side, and they're burnt out, and there's so many articles being written about physicians burning out, about patients being unhappy. And I really hope that integrative and functional and lifestyle medicine become the baseline, that instead of calling it such, that's just going to be medicine. That's going to be primary care, general practice. That's the lens that every provider and physician will be practicing through, because it's the best case scenario, both for the physician and for the patient. And there's sustainability, there's optimization, and it's what makes both parties happy. And I just really hope that through Love.Life telehealth and Love.Life, our in-person El Segundo location, that we're able to expand further and provide this care, so that medicine does turn around.
I completely agree. And it has been such a pleasure to talk with you today. I think we touched on a lot of really important things, got to know you a little bit better. So thank you again. I will say, that if you have not had the pleasure of working with one of our doctors yet, now is the time. Maybe you are suffering from chronic conditions. You just want a doctor who is on your side, supportive of your lifestyle. Maybe you're sick of taking all the medications. Maybe you just don't feel your best. Please come visit us at either telehealth.love.life to make a virtual appointment with one of our 5 fantastic doctors who cover all 50 states, DC, and international. Or if you live near El Segundo, California, you can go to Love.Life to learn more about the in-person appointments with Dr. Emanuel or the other doctors that she works with. Until next time, I am Dr. Niki Davis with Love.Life Telehealth. Thank you again, Dr. Emanuel. It's been a pleasure talking with you today.
Thank you so much for having me.